Gluteus Maximus. It is a huge or bulky muscle present in the gluteal region. Origin. It arises from the number 1 outer sloping surface of dorsal 1/3 of the iliac crest. This is ventral 2/3 and this is dorsal 1/3. So outer sloping surface of dorsal 1/3 of iliac crest. Number 2, from the gluteal surface posterior or behind the posterior gluteal line. Number 3, okay, lateral half of the dorsal surface of sacrum. Number 4, sacrotuberous ligament. Insertion. The muscle fibers are inserted into gluteal tuberosity and iliotibial tract. The superficial part of the entire muscle and the upper half of the deep part of the muscle are inserted into iliotibial tract. The lower half of the deep part of the muscle is inserted into gluteal tuberosity. So 25% of the fibers of the bulkiest muscle is inserted into gluteal tuberosity, which is bony insertion. The remaining 75% of the fibers are inserted into iliotibial tract, which extends from the ilium to the tibia, that is the thickest fibrous band. Gluteus Maximus. Origin. It arises from the outer sloping surface of dorsal 1/3 of iliac crest. So this is the iliac crest, this is ventral 2/3, this is dorsal 1/3. In the dorsal 1/3, this is outer sloping surface, this is inner sloping surface. So first origin, outer sloping surface of dorsal 1/3 of iliac crest. Number 2, from the gluteal surface it is arising. Where? See, this is the posterior gluteal line. So behind the posterior gluteal line. So second origin, it arises from the gluteal surface behind the posterior gluteal line. Number 3, from the lateral half of the dorsal surface of the sacrum. So ventral surface, dorsal surface, lateral half of the dorsal surface of the sacrum. Number 4, okay, there is a ligament, sacrotuberous ligament. See, if it's see, this is the articulation of the sacrum and hip bone. Okay, from the sacrum to the ischial tuberosity, sacrotuberous ligament. See, from the sacrum to the ischial tuberosity there is a ligament. So from the sacrotuberous ligament also the muscle arises. Insertion. The gluteus maximus is inserted into, this is the gluteal tuberosity which is in line with the greater trochanter. This rough 5 cm rough ridge is known as gluteal tuberosity. It is inserted into the gluteal tuberosity. Only 25% of the fibers are inserted into gluteal tuberosity. Remaining 75% of the fibers are inserted into iliotibial tract. Now supply. It is supplied by inferior gluteal nerve. Action. It is a powerful extension of the hip joint. So extension of the hip joint is caused by gluteus maximus muscle. Clinical anatomy. It is the common muscle used for intramuscular injection. The upper lateral quadrant is used for intramuscular injection. Thank you.